Most candidates who failed the DHA exam don't fail because they lack medical knowledge. They fail because their brains simply run out of gas. It is a test of cognitive endurance and ruthless time management. This instruction page from a standard test booklet shows exactly what you are up against. Notice the strict parameter right at the top: 100 compulsory questions and exactly 2 hours to finish them. If we break down that math, you have exactly 72 seconds per question. But once you factor in the time it takes to read the prompt and scan the answers, your actual window to make a clinical decision drops to about 30 seconds. We are going to put you through a stress test to simulate that exact pressure. You are about to face 3 real exam questions, back to back, with a strict 30-second countdown for each. To pass, your recall has to be automatic. If you hesitate and spend 2 minutes on a single tough question, you create a cascading time deficit that will tank your entire score. Here is your first question. What is the normal hemoglobin concentration in an adult male? The clock is running. Eliminate the distractors immediately. Time's up. The answer is B. The standard reference range is 13 to 17 grams per deciliter. That type of parameter question is a gimme. In a real testing environment, you need to lock that in within 10 seconds so you can bank the extra time for longer clinical vignettes. Moving to question 44. Watch out for the capitalized "not" in the prompt, a classic cognitive trap. Isolate the test that doesn't fit. And stop. The answer is A. Blood urea, serum creatinine, and BUN evaluate kidney health, while blood sugar points to endocrine function. Missing that negative phrasing because you are rushing is the #1 unforced error candidates make. You have to read the exact question being asked. Jump to a new test page. Question 69 asks you to name the test used to detect glucose in urine. 30 seconds. Differentiate between Foucher's, Benedict's, Hayes, and Rotherus tests. Lock in your choice. Time. You should have selected B. Benedict's test detects reducing sugars like glucose. You just handled 3 rapid-fire context switches. In the actual Prometric Testing Center, you have to survive that exact cognitive whiplash 33 times in a row. Tally your score out of 3. If you hit a 2 or a 3, your baseline is on track. If you scored a 0 or a 1, you have a critical vulnerability to address before test day. This diagram breaks down how to analyze those errors. If you simply didn't know the fact, that is a knowledge gap, and you need to review your textbooks. But if you knew the material and just ran out of time or misread the prompt, that is a processing error. You fix that by taking more timed mocks. Note your score today. Go back to your study schedule and return to this exact timed simulation in 2 weeks to measure how much your reflexes have improved. Passing the DHA exam requires a solid foundation of medical knowledge, but ultimately it comes down to forging an unbreakable rhythm that survives the relentless ticking of the clock.